Okay, here we are at the home stretch, part 7. In this video, we'll be covering hemodialysis, peritoneal dialysis, and kidney transplant, and this is in chapter 37. Hemodialysis is the most common type of dialysis. This process uses the artificial kidney called a hemodialyzer to remove waste and extra fluid from the blood. The blood is removed from the body and filtered through the artificial kidney, and the filtered blood is then returned to the body with the help of the dialysis machine. So, vascular access. Hemodialysis requires a permanent way to access the bloodstream for blood removal and then return to the body during dialysis. The typical permanent vascular access options are the arteriovenous, the AV fistula, which is considered to be the gold standard, or the vascular access graft. Fistulas or grafts are placed in the arm when possible, as soon as possible. An early referral of a nephrologist can allow for establishment of the vascular access so that it's matured or developed before the need for dialysis. So this is when the central catheter should be, so a central venous catheter with 2 or 3 ports, which is the third port can be used for the medication by trained staff, is placed in the central vein or temporary access. Central catheters should not be used long-term because of the risk of infections. So it is important to save the veins of the patients with chronic kidney disease for the possible future fistula creation. The non-dominant patient arm should be not used for intravenous lines or blood draws or blood pressure to avoid any damage to the veins, because it will likely be the arm used for fistulas. So early consultation with a nephrologist can identify which veins to protect. So here you'll see the AV fistula, which is created from your own vessels because the vein doesn't normally have a strong blood flow and is not large enough to accommodate the needles required for access in blood. So a connection is made between your artery and vein, resulting in enlargement of the vein, which allows your dialysis care team to successfully place the needles used for dialysis. And then you see the AV arteriovenous graft, which is the AV graft. This graft is an option for patients whose veins are very small and most likely won't mature into a working fistula. So a surgeon will connect a soft, like a biocompatible flexible tube between the artery and the vein beneath the skin. So the blood from the artery will flow through the AV graft and then into the vein. So this creates an area on your arm suitable for hemodialysis because the AV graft materials is strong enough to use repeatedly. And here you see a patient undergoing hemodialysis. So for vascular access care, fistulas or grafts that are created for dialysis should not be used for any purpose other than dialysis. You want to watch signs of bleeding or infection at the access site. Listen for bruit at the access site by placing a stethoscope gently on the site. A bruit is a swishing sound made as the blood passes through the access site. Gently palpate the site for a thrill, which is a buzzing or pulsing feeling that indicates good blood flow through the access site. So when you don't hear that and you're just, when you don't feel the thrill, there's something wrong. So definitely contact a provider for that. Do not take blood pressures or use a tourniquet, draw blood, or give any injections or start any IV lines in that arm. Many hospitals have indicators such as red arm bracelets to signify that the arm should not be protected. Sometimes it's pink. A sign above the bed may also be used. Teach the patient to keep the access site clean and not to bump or cut it. Teach the patient to follow weight restrictions for lifting with that access arm. Teach the patient to avoid wearing constrictive clothing or jewelry or access over the access site. And also the patient should avoid prolonged bending or sleeping on that arm with the access site. And notify the healthcare provider if you see any signs of bleeding, reduction circulation, or infection occur in the access site. if there's coldness, numbness, weakness, or redness in that extremity, and if there's fever, draining, or swelling. Peritoneal dialysis is a way to remove waste products from blood when your kidneys can't adequately do their job any longer. So this filters the blood in a different way than does the common blood filtering procedure called a hemodialysis. During the peritoneal dialysis, a cleansing fluid flows through a tube catheter into a part of your abdomen. The lining of your abdomen, which is called the peritoneum, acts as a filter and removes waste products from your blood. After a set period of time, the fluid with the filtered waste products flows out of your abdomen and is discarded. So these treatments can be done at home or at work while traveling, but it's not for everybody because you do need the manual dexterity and the ability to care for self at home. Also, the client will need a reliable caregiver. So there is the exchange process has has the filling process, the dwell time, and the draining. The fill step involves instilling sterile dialyzing solution, which is called dialysate, into the patient's peritoneal cavity through the catheter. The amount of solution individualized by the body weight. So the solution is left to dwell in the abdomen for several hours, allowing time for the waste products from the blood to pass through the peritoneal membrane into the dialysate solution. The solution is then drained out of the body and discarded. So this process is repeated 3 or 4 times a day and is continuous for the patient. Several treatment plans use exchange process. The treatment plan that best suits the patient needs is determined by the patient and the dialysis team. So differences among hemodialysis and peritoneal dialysis. Continuous renal placement therapy include following. So patient access, hemodialysis requires vascular access. Peritoneal dialysis requires insertion of catheter into the peritoneal cavity. Equipment, hemodialysis requires a specialized and complex dialyzer. Peritoneal dialysis does not require the specialized dialyzer, although a machine are available for these type of therapies. In training, hemodialysis requires a skilled hemodialysis nurse. Can be done by a hemodialysis nurse in a critical care setting. Peritoneal dialysis can be done by the patient with training. Timing, hemodialysis is intermittent, peritoneal dialysis and are continuous. A solute removal, hemodialysis and the peritoneal dialysis use the principles of osmosis and diffusion, which require dialysate solution. And that's it. And the cardiovascular effects, hemodialysis may cause hypotension, which is at risk for unstable patient. Peritoneal dialysis have a few cardiovascular effects. A kidney transplant is a surgical procedure in which a healthy kidney from either a living or deceased donor is placed into the lower abdomen. It is not a cure but a treatment for chronic kidney failure. It is a treatment of choice for those who are considered suitable candidates for the transplant. Kidney transplants have many advantages. It can treat kidney failure and improve health, provide a lifestyle free from dialysis. Usually they will have fewer fluid or diet restrictions after getting a new kidney. Most people even feel well enough to even return to work. So with kidney transplants, it always comes with responsibilities. For new kidneys to work, medications like anti-rejection drugs need to be taken exactly as taught for as long as the kidney is working and maybe perhaps your whole life. These medications can have side effects and complications may arise, such as rejection of the kidney or an infection. So as you develop your nursing care plan for a patient with chronic kidney disease and kidney transplant, nursing diagnosis to consider is excess fluid volume, and this is related to the kidney's inability to excrete fluid. Impaired skin integrity related to dryness, excess fluid, and crystal deposits. Activity tolerance related to anemia secondary to impaired synthesis of the erythropoietin by the kidneys, and risk for injury. And this is related to bleeding tendency from platelet dysfunction use of heparin during dialysis or gastrointestinal bleeding, and then risk for infection. And this is related to impaired immune system function. And then there's imbalanced nutrition, less than body requirements related to restricted diet, anorexia, nausea, vomiting, and stomatitis secondary to the effect of excess urea of the GI system. Continue on with the nursing care. Clients who have excess fluid volume, what are you going to do as a nurse? You're going to monitor weight, you're going to monitor INOs, fluid restriction, monitor for fluid retention. So you want to report if the client has a 2-pound weight gain. Electrolyte imbalances, obviously anything with exchange in the dialysis and the kidney transplants. You want to monitor lab values, electrolytes, dietary restrictions, implement dietary restrictions, monitor dysrhythmias. Because patients who have anything with kidney failure or dialysis or even kidney transplant, they're at risk for, hypokalemia, or hyperkalemia, and magnesium or sodium deficits. Nursing care, continuing with the waste products, you want to provide oral care, skin care, protect from injury, and for the impaired hematological function, you want to protect from injury and infection. And that's it for this video. So I think this is the end of chapter 37.